Hello everyone, Sasha here from Eternal Beauty Med Spa. I'm going to show you what Tox looks like when it's injected on one half of the face and neck. Tox was injected on this side. I'm calling it my right because this is my right, but for you the image is flipped. So we're going to talk about it in terms of where you see the logo and where you don't. On this side there's no logo, that's the right side, and just by looking at me you probably can't tell a whole lot of what has changed. We're going to do a deep dive into certain areas of the face and I will tell you exactly what was done. On the right side of the face, this side, Tox was injected into the forehead, into the mid-brow area, on the right side of the nose. So we're going to talk about these three areas because they're typically injected together, and I'm going to animate and show you what that looks like. You can see this side is moving and wrinkles are forming, and this side is not. Now that doesn't mean my brow is still and I don't have expression. I do. The Tox is fully kicked in, but my brow is still moving. Now I'm gonna frown. You can tell that this line is forming and this is still. And then this is pretty good, pretty tight, and this is a little more wrinkly. This is the line we're after between the nose. Let's move to the eye area. Let's look very closely at the around the eye area and the under eye. I'm going to animate, I'm going to smile, and you will quickly see what the difference is. You see how this eye is the non-injected eye. It really starts to kind of squish up and you can see the lines forming. It looks kind of weird side by side, but if both eyes are more open, trust me, it's a better looking smile. That's because Tox was injected all the way here, all the way around, and also on the under eye. You can see that there's a wrinkle forming here. That's the side that wasn't injected, and there is no wrinkle forming here. Also, when I squint, if you look closely, you can see lines are getting sequestered kind of towards the middle, and here that's not happening. Now let's move down to the lower part of the face. Let's talk about the around the lips. I'm going to purse my lips and you will see that this is more relaxed and this is more tight. When the lines here are more tight and the muscles are more tight, these lines tend to form. They're called the smoker's lines. You don't have to be a smoker to have those lines, but that's just what they're called. You're going to see how this side is fuller, right? And this side is more kind of contracted and tighter. This is called the lip flip. When we relax these lines, it kind of gives a little bit more of a show on the lip, and it's called the lip flip. Now let's move on to lower face and talk about the around the lip area. This is the mouth muscle, is a circular muscle. When we relax a part of it, it prevents the wrinkles from happening here. Those are called smoker's lines. You don't have to be a smoker to have those lines, but here they are. And you can tell, but this side just looks fuller and this side is more wrinkled. From a patient perspective, in terms of sensation, the sensation is the same. On occasion, it feels kind of numb and funny at first when you get injected. Some patients complain about keeping water in when they're brushing their teeth. Besides that, it's really not an issue and it goes away in a couple of weeks. As I told you before, this muscle was also injected for a slimming face effect. This really won't show itself as a slimming face effect for probably about a month or so. It takes a while for this muscle to become weak and protrude less. So there's nothing really to talk about except for when I chew, I don't really feel a difference in terms of strength on one side versus the other side. But visibly, we're not seeing a difference. We actually may not see much of a difference because this is an area that I really needed to treat. I don't feel like I have protruding masseter muscles that I don't like the way they look, but some people do, and when those muscles are injected visibly, it makes them look a lot better because their face is a lot slimmer. So as we continue moving down the face, we're going to talk about what was done over here in terms of injections all along the jawline and the neck. And these areas all kind of work together. This muscle, the chin muscle, and then the platysma muscle, and then the platysmal bands that form on the neck. So we'll talk about that as a complex. I'm going to animate, and you're really going to see a difference in what I'm talking about. There are certain faces we make, and this is the I don't know face. what you're seeing is the corner pulls down. Together with the I don't know face comes the chin. The chin comes up. When the chin comes up, it causes this line to crease. We don't like that. That's why the chin gets toxed also. The chin was toxed here, and then the DAO was toxed here to prevent the corner of the mouth to be pulled down. Why is this a problem? Well, I'll show you on this side why it's a problem. When we animate this way, we sequester these muscles. These muscles pull down and cause aging. This whole side also pulls down and causes aging. Besides the lower face being pulled down, some people also activate their neck when they animate. When they make a face like, something didn't go right. This is a typical female face where we tend to apologize for things we really didn't do or not at fault for, but we make this face. A lot of women do. I do too. Now watch. The corner comes down. These muscles are activated. Those are the platysmal bands. And on this side, I'm able to make somewhat of that face, but these muscles are pretty quiet because this whole area was injected. The result is it's preventing from getting pulled down, meaning this lower jowl area stays where it is and even goes up instead of being pulled down with animation. This is really the key to lower face.